Williams, if you would do the North Texas System and the Health Science Center at Fort Worth in just one presentation, please.
Thank you, Madam Chair Huffman, and Vice Chair Hinojosa, and committee members. I'm Michael Williams, Chancellor of the University of North Texas System. I appreciate speaking with you today about the UNT system and our legislative funding priorities under Senate Bill 1. A little background and vision. The University of North Texas System is the higher education leader for the Dallas-Fort Worth Metroplex. It has 5 campuses in 4 cities: Dallas, Denton, Fort Worth, and Frisco. At our core, we're committed to transforming lives and expanding economic opportunities through education. We prioritize serving our most important stakeholders, Texas students and their families. We're driving innovation by aligning degree programs with workforce needs and industry demands, and adopting forward-thinking educational models and conducting groundbreaking research and discoveries, as well as integrating business principles into higher education to ensure relevance and efficiency. The UNT system is committed to equipping Texas students with the skills and knowledge needed to thrive in a rapidly evolving and changing workforce. This past year has been an exciting one for the UNT system. We welcomed new leadership across our campuses. We launched high-demand degree programs in nursing, data science, and business. And last fall, we enrolled more than 52,000 new and returning students across our system.
Okay.
Each of our institutions play a vital and unique role. University of North Texas, our flagship institution, is a Carnegie R1 research university, driving innovation and meeting the needs of North Texas. With more than 46,000 students in Denton and Frisco, UNT is now the 4th largest university in Texas. We're committed to student success, graduating students faster with lower debt, and ensuring they are prepared for the workforce. University of North Texas at Dallas is the only public university within the city of Dallas. And UNT Dallas serves a very unique student population, as nearly 70% first-generation college students. It's also one of the most affordable universities in Texas and remains true to its mission of transforming lives and strengthening the community it serves. UNT Health Science Center in Fort Worth is a health sciences education, research, and patient-centered care university. Its Texas College of Osteopathic Medicine this year was ranked as a national Tier 1 medical school by U.S. News and World Report. And the new College of Nursing has now opened both a master's class and a BSN group class as well. So that it is addressing the Texas growing healthcare workforce needs, especially in nursing. I want to also take just a minute to express my sincere appreciation and our appreciation for the 88th Legislature's investments in formula funding, Hazelwood, the employee group insurance. All those have allowed us to spend more funds directly supporting our students and maintaining affordability. The creation of the Texas University Fund has been transformational, and that has allowed UNT to accelerate research innovation, retain top talent, as well as enhance national standing. And President Keller will share more about TUF's impact on us later. Looking ahead to fiscal year 26-27, we can only build on this momentum and continue delivering results for Texas students. Our key funding priorities are to focus on formula funding increases. Formula funding, as many of you know, is the most effective way to support students directly in the classroom. With North Texas experiencing rapid population growth, the demand for higher education continues to rise. We respectfully request increased formula funding to offset the rising costs and ensure continued educational excellence. Second on my list is a higher education fund, or the HEAF reallocation. As the legislature revisits HEAF allocations, we urge consideration of enrollment growth and inflationary pressures that have put extra pressures on our current facilities. Since 2015, UNT's enrollment alone has grown by almost 10,000 students. And if you put that in perspective of an entire mid-sized university being added onto UNT since 2015, you can see very clearly the need for the support for our facilities. UNT Dallas's enrollment has surged by over 50% in that same time period. So increased HEAF investment is critical to us, and it will support infrastructure, modernizing opportunities for our research spaces as well as teaching spaces, and maintain competitive facilities. And one of our system initiatives is better, our single system initiative and a special item is Better Together initiative. It leverages our campus's drive to collaborate with each other in an idea of using the power of synergy to gain opportunities through collaborative programs like course sharing across the system, as well as research opportunities, using the power of the research going on at the Health Science Center as well as Denton at UNT. We see an opportunity to scale innovative solutions using the Better Together program, and we can talk about that more if you have more questions about that. In my closing thoughts, it's just to leave you with this, that each of our institutions are working to address what we believe to be critical state priorities, especially around the Texas workforce pipeline that I mentioned is continued to evolve, supporting students from classroom to career, advancing research to tackle significant health challenges such as Alzheimer's in veterans, which I'll be glad to talk to you more about in just a few minutes. The UNT system is uniquely positioned to meet Texas academic, healthcare research, and workforce needs, and with strategic support from the 89th legislature, we will continue to lead higher education in North Texas while ensuring a strong return on investment for the state. I want to thank you for your time, and I look forward to any questions related to the system. Then I'm happy to move on to the Health Science Center chair.
You can move on to the health science.
Okay.
Take questions. I don't see any questions.
So I appreciate the opportunity to share some insights into the Health Science Center's work in Fort Worth and discuss the legislative priorities specific to that campus. The Health Science Center at UNT in Fort Worth is one of the nation's premier health science centers with strong focus on primary care and rural health care. We're now home to 6 schools, including the Texas Osteopathic Medicine, which I mentioned earlier has now been ranked as one of the top Tier 1 medical schools for primary care by U.S. News World Report this past year. Only one of 2 in Texas and only one of 2 osteopathic programs in the entire nation. TCOM is also ranked as one of the most affordable medical schools in the country, and 60% of our TCOM graduates go into primary care, and over 60% stay in Texas for their residency programs. Beyond medical education, Health Science Center is advancing cutting-edge research and innovation. We lead a 10-year, $149 million NIH grant that was developed for precision medicine approaches for neurodegenerative diseases like Alzheimer's, Parkinson's, dementia, and Down syndrome. We're a values-driven institution, and transforming lives, training future healthcare providers, and pioneering solutions for a healthier Texas is what we're all about. I want to also express some appreciation for the legislature, the 88th legislature, related to other funding priorities. So I would say thank you to all of you for Senate Bill 1, and it reaffirms the state's strong commitment to health-related institutions like UNT Health Science Center. But because of that support, we were able to increase pipeline agreements with undergraduate institutions across DFW by over 45%. We expanded workforce education programs, and we welcomed the inaugural class of nurses at the UNT Health Science Center, which again, as I mentioned earlier, is addressing the state's critical nursing shortage. Our master's program started this past fall, and our bachelor's program just started this spring. So your continued support is helping Texas build a robust, well-trained healthcare workforce. Our legislative priorities for the 26-27 biennium include our top priority is increased investment in the state's HRI funding formulas. Formula funding is essential to provide high-quality education and hands-on training for Texas, especially with future healthcare professionals. Performance-based research funding has been instrumental in the Health Science Center's rapid growth in research. Just since that formula was implemented in 2022, we've seen our research expenditures have grown by over 48%, surpassing $100 million in fiscal year 24. This funding enables us to expand critical research in areas like neurodegenerative disease and precision medicine. Our aging infrastructure and inflation have placed a strain on our ability to invest in other capital projects on campus. So to sustain our momentum, we request increased investment in the Higher Education Fund, HEAF funding. And then we also have 2 exceptional item requests. First and foremost is the Operation Enduring Brain Health. We're requesting support for Operation Enduring Brain Health. It's a state-of-the-art research initiative. It's focused on Alzheimer's, dementia, suicide prevention among underserved veterans. UNT Health Science Center is already a national leader in aging and Alzheimer's research. And as I mentioned earlier, Dr. O'Brien, who leads that team, has secured $149 million in federal funding for what we consider to be the most comprehensive study of brain aging and Alzheimer's that's ever been conducted. Now we seek to expand this work specifically to veterans using the already existing research infrastructure and expertise that he and his team provide. In the first 2 years, this program would enroll 1,000 Texas veterans in groundbreaking research studies, develop, test, and advance new treatments for Alzheimer's in veteran populations. It would also innovate therapeutics for depression and suicide prevention and create collaborative data networks to collect information from other areas that are focused on this work. And we think overall this begins to provide a hope for and solid cures potentially for how to prevent and improve veteran brain health. We want to train the next generation of healthcare providers to address brain health challenges. And I'm sure many of you are already aware that Texas has over 1.4 million veterans and leads the nation and is number one in veteran population. Veterans also struggle, as many of you know, for access to the latest quality cutting-edge healthcare related to brain-related issues. And it's clear now that PTSD is a precursor to potential later development of Alzheimer's and other related dementias. Number 2 on our list for requests are advancing innovative technology for a healthier Texas. This program allows us to use a data-driven initiative to transform public health outcomes statewide. It's a program based on data science, machine learning, and community modeling to begin to understand how public health dilemmas continue to grow, and despite all of our efforts to better care for those patients. This first pilot would focus on maternal infant mortality. And also, I'm certain many of you are already aware that in Texas, we have a very high level of over almost 6 maternal deaths per 1,000, which may not sound like a lot, but it's substantial. And TMA had a recent publication that showed that Texas ranks 50th out of all 50 states in access to quality prenatal care by lots of populations in Texas. So we also believe this program would improve primary care delivery in underserved areas. And by developing these predictive models to forecast healthcare workforce demands, it would help better understand where these workforce populations should be sent, hopefully. So once proven, we think this model will expand to address other priority health conditions and disparities across Texas. So in closing, the Health Science Center is committed to training the next generation of health professionals, driving medical research, as I've already discussed, and improving healthcare access and delivery across Texas. So with your continued support, we will remain at the forefront of medical education, research, and innovation. And I thank you for your time and for your commitment to improving the health of Texans, and I'm happy to answer any questions.
Thank you. Senator Colcourse.
Hi, thank you. Great to see y'all.
Thank you.
Go green, go big green. We love y'all.
Thank you.
Wanted to follow up on a couple of things. Y'all have disaffiliated with TCU now on your med school. Is that correct?
Yes, ma'am.
Okay, so y'all have 2 separate schools. How are we doing with rotation slots in the Fort Worth area? GME.
Well,
Clinical.
they've been okay. We can always use more. We have the Health Science Center has always had a program by which students were in Fort Worth, but they also go to other locations in Texas as well. Corpus Christi, East Texas, and other places in the state. So we've worked with several hospitals in the Metroplex, but it seems to have so far at least been working. And also, I think the other thing that goes along with that is we have not increased our class size, nor has TCU since inception.
Okay. So another question is, about the maternal health. And, one of the things that I, want to emphasize, and we're very close to having it complete is our own database. Last session, I chose to do this through the budget. Madam Chair, thank you for your support of that.
Yes, ma'am.
There was a lot of pushback. I could not figure out why we would send our data to CDC to have them compile it and throw it back to us. And really, we have been able to, review it and say there are a lot of errors, because if you can't define the problem, you can't solve the problem.
Right.
So hopefully we'll have scrub data for y'all to be able to, address it. We have 12-month Medicaid now. So there are certainly things that we are offering in Texas that we haven't. The bridge, well, we're still negotiating. At least the Biden administration was going to stop the Healthy Texas Women waiver, but I think that they gave us a 6-month reprieve. We'll continue to work on that. So, challenges, but I think, great opportunity. The AIM bundles, I hope,
Right.
We were leading Texas on the AIM bundles when I put it in a bill the first time, and we jumped out there and we were beating California on it. And, in talking to some experts in the field, I quite honestly think that we just got a little complacent on it. Mm-hmm. And so as y'all work through data, I'd like to receive that.
Okay.
But that's not the only thing in public health, but certainly we want those numbers to dissipate. On making Texas healthy again, there are multi-factors. I'm focusing on food right now and the food supply and potentially some of the medical practices that we have. But there will be an initiative. We'll file Senate Bill 25 very soon. The Lieutenant Governor was great to give a low bill number to this. It's a starting point. It's a conversation piece. So I look forward to y'all coming back in and working with us. And so last question would be on the GME slots. Are y'all finding that for-profit hospitals are selling their slots, or
We
not
haven't
seeing that yet?
we haven't experienced that. What we have experienced is some of the private, more like HCA, for example, has been a system that we've worked with closely through the years, and they've been very eager to develop more slots. However, in the Metroplex, there's several key health systems that also have gotten into the GME arena. And so we've seen a net loss of about 27 slots related to HCA cutting some out, but also starting some other programs. But our focus is always to make sure that we can continue to incrementally grow GME in Texas so that we can keep more of our students in Texas.
Very interesting. Thank you. Thank you, Madam Chair.
Thank you. Okay, that's all the questions we have. Thank you very much for
Thank you
being
very
here.
much.
We'll move on to the University of North Texas. Harrison Keller, President.